And now it's setting up the webinar. All right,
We'll get there.
we'll get there. All right, we are live. Jenny, thank you. I appreciate it. I know that, are you working from home?
I am working
I
from
know
home.
you are, you're a psychologist at a local hospital. So how's the hospital environment right now?
Yeah, well, so I am in a position right now that's mostly research. And so we've been able to move the things that we do to either telephone or telemedicine. And I know hospitals all around here are doing their very best to move any kind of outpatient care or care that may not be considered kind of emergency at this point to either web medicine, telemedicine. So I encourage you, if you need healthcare, please do reach out to your doctor through things like, some of the MyChart and personal chart systems. And, your doctors are there, they're ready to help you. It's
Right.
just they may be helping you in a slightly different way right now.
Totally.
So
How do y'all classify mental health in terms of it being something that's like essential healthcare versus elective healthcare or stuff that can be done at a later date? I mean, that seems like a tricky space for y'all to navigate.
that is a beautiful way to put it. It has been a very, I think, tricky space to navigate. I firmly believe mental health care is essential. And at the same time, I think there are ways we can be creative.
Mhm.
Telepsychology and telepsychiatry has been in existence for a while now, and a lot of systems have gone over to using those mechanisms of connecting with patients. So there's certainly systems to be able to do that. And also,
Right,
a lot of our major psychology organizations have really been providing us with a lot of resources so that providers who maybe haven't practiced this way before have some information sheets on how to do.
right,
We have some example informed consents so that patients can understand what the slight differences might be. And
right.
so I think we're all trying to switch over as quickly as we can. And
Yeah,
of course, there's going to be people who have really high urgent needs that may need to still present for in-person care. And so I
right,
think hospitals are keeping systems open to help those people.
right,
Um, I would say the main message I have for folks who are already in treatment, like seeing a therapist or a psychiatrist, keep your appointments, contact your provider and see if they've switched to telephone or telemedicine, and
right,
really try to stay consistent. That's really important right now.
right. Yeah,
Please stay on your medicine. So if you're somebody who takes medications right now for anything, anxiety, depression, bipolar, etc., stay on your meds. Make sure you keep your meds filled. Talk to your doctor by the messaging systems if you have any questions. We just really need people to do their best to keep with their general treatment practices.
yeah.
And
As someone who takes medication for mental health, one of the things that I think is really important is like staying on top of the refilling, and then getting like maybe taking a few extra days to go ahead and call that refill in and let some lag time exist, because like what we don't want is a bunch of people not filling their scripts or there be a run at the pharmacy or things like that. It's just really important to stay up on it. I appreciate you telling folks to do so.
well, and I
Now
think
is not the time to go off your Zoloft, right? Like stay on it,
And
right?
I like
Yeah,
your point of trying to get it filled a bit in advance, just because there's obviously a strain on the healthcare system right now. And so being thoughtful that if you know you're running out soon, go ahead and put that in for refill as soon as you
right,
think about it. And yeah, these medications too, they can have some side effects if you suddenly stop. And so that's why you want to make sure to stay on top of your refills, because now it's just not a good time to be having those kind of GI side effects and sometimes mood side effects that can be really
right,
risky if you suddenly
right.
stop. So again, message your doctor if you have questions about this, but I'm hopeful people will keep on with their kind of healthcare ways of taking care of themselves.
So what are some of the things that you are, as a psychologist, both concerned about in terms of like what social distancing and isolation and quarantine and whatever words we're going to use to describe our current reality. What are some of the things we need to be paying attention to in the midst of this, especially with our mental health?
Yeah. Well, I know you and I've had conversations separately.
Yeah,
Just um, my worries about the impact of social distancing on people who are just already prone to loneliness or to being in situations in our culture where they just don't get as much contact as would probably be helpful. So there's part of me that's concerned about that. I will also say I'm kind of a strange clinical psychologist in that I also have my master's in public health. So I'm always also
right,
thinking about the big picture population health side. So this is one of the situations where I think sometimes those two pieces of training, they complement one another, but they feel a little at odds too. The public health side of me really wants everybody to listen and follow instructions and be really thoughtful right now. And at the same time, I know that's going to be stressful for people. And
right,
so the psychologist side of me says, okay, so we need to be talking out of the gate about ways people can keep routines, ways people can virtually connect to one another, and ways that people can, just take care of general self-care right now. I know we kind of overuse that term, but making sure you're sleeping and eating meals the way you normally do and exercising and taking some time away from the constant stream of information that we have coming. You do need to stay
right.
informed and you need to give yourself a break from that.
Yeah, there's that balancing act, right? Of like being informed and not being obsessive about it, and like recognizing in ourselves when we may become obsessive about all the information and trying to get the exactly the right information and trying to process that, and it can become like, I don't know. I think we're prone to like thinking that like more information is going to like somehow make us healthy, and the truth is like the more we get obsessed about information, the more we can actually be, I think, challenging our own mental health and putting us in situations where we're not then sleeping or we're not taking care of ourselves, or our worry and anxiety can heighten so much that we just get into a state where all of a sudden we're more prone to like a downward spiral.
Yeah. That's one reason I've really appreciated the list that you all put together at White Rock that has some
Yeah,
resources collected for folks from reputable sources and from helpful national and local agencies that think
right.
about these kinds of things all the time. So hopefully that's helpful to our community and other
Yeah,
communities. I know I put it
yeah,
on Facebook and
absolutely.
my friends were sharing it in Montana, and there's people
Cool.
all over the US looking at this list. So
Awesome.
hopefully it's
Yeah,
helpful.
so our list on our website is under COVID resources on the very top of our page. The vast, there are a lot of resources that Jenny has vetted and sent our way, and we're just posting it there. We're trying to collect stuff that we all agree is helpful, that isn't too alarmist, but is very accurate. And we're going to keep a running tab of good resources there. So a lot of that is thanks to you, Jenny, for sending them on to us and giving us good stuff. And I think I hope people are engaging with it, because that resource list on our website is really good. There's really good stuff there, and I think it can be helpful to us in the midst of all this.
I think to your point too about, we think more information is better, better, better. I think this speaks kind of to the way a lot of us handle our lives. We want to be the best at everything we do,
Right, right.
the best at getting all of the information and being the best at quarantining. I can't tell you how many articles I've seen about, let's take this situation and come out of it like a phoenix from the fire and make yourself so much better during these days that you're at home, and all these self-improvement articles. And it fits with the way our culture typically interacts with these
Right,
kinds of things. And at the same time, I hope that we're all kind with ourselves and patient. There's a lot of
yeah,
anxiety around that. And some people channel their anxiety into learning a new skill or, starting a new exercise regimen. And some people have more trouble with that. And it's okay. We don't all
right,
have to come out of
right.
this our new best selves, because I think when we
Mm,
come out of this, there's going to be a lot of things to figure out for people, financially and emotionally. And So I hope everybody can, read those.
Extend a little grace to ourselves.
Grace is
Yeah.
the word. Grace is the word, man.
I think, and it's fascinating because in this, like, because we're so connected through social media now, like that's where we're sharing our sources, and it's collapsing in on that's also how we're projecting ourselves to the world, right? And so yeah, this balance between trying to do everything perfect, right? Or at least project perfection. I'm like, I've got my kid's schedule totally figured out. I've already done my, CrossFit WOD for the morning, and look at this, somehow I found all the organic vegetables for my smoothie. I want to show you all how well we're handling it over here, versus the other side of the equation where we're not taking care of ourselves at all. And I think, like, we have to find that middle ground. And I think that's why when we let go of the perfection side of like our image, and we get more real and honest and talk about our good days and our bad days, in community, it's a much more appropriate, helpful way of understanding, um, this kind of process that we're all going through. I think it's so hard to push, normalcy and like the ups and downs of everyday life, um, onto social media. And one, that's why I find you to be really helpful in this. Jane. You do a really good job of your own social media stuff being really vulnerable and real and like honest. And I think, like, when we can be honest with ourselves openly in a public forum, then we're actually creating community that's reliable and can be beneficial to us. But it is going to be a challenge. I think you're totally right. Like, we're going to try to think, okay, we've got 8 weeks or whatever it is, right? And we can like finally get all the workouts in, or get all the, chores done around the house, or we can have this perfect time with our kids. But I can already tell you, Cash is already wearing me out. And it's what, day 4, day 5? Like, I'm
Oh,
already exhausted from being,
he's,
right. Maybe we'll pay teachers more out of the end of this thing, right?
oh, yes, snaps. We will hopefully we will figure out how to give them raises and do all the for teachers after this.
Right, totally.
I also think, the counter to this point too is remembering that those of us that can have these sort of perfectionistic goals perhaps, and show this side of ourselves on social media and be the best at quarantining, there's a whole world out there of people that don't have that privilege, right? That this is impacting their ability to work. This is impacting their ability to connect with people that they care about. And so I think remembering that too. I think I find myself just really stretching in that challenge of recognizing that this is a big deal, but it's also a manageable big deal. And for
a lot of us, right? Yeah.
And for a lot of people, it may not feel that way, and that might indeed fit the facts, right? And so, how can we really maybe use some of that desire to be the best at quarantining to figure out how to be the best at kindness, and see if there's ways in which we can help people who need it, who don't have the things we have, privilege we have, who don't have the resources to maybe fall back on that some of us for lots of.
Can you talk to, I know you've done a lot of research around resiliency. Can you talk to us about like what that one, how you define that term, and how do you see that particularly, playing out in the midst of, this COVID-19 pandemic?
Yeah. So resilience is at its basics, the ability to bounce back from stress. And some people say it's the ability to kind of bounce back to how you were doing before the stressful thing happened. Other people say it's kind of bouncing back to being even stronger than you were psychologically before the stressful thing happened. And, it's interesting. I've spent a lot of my time researching resilience in the context of helping parents understand that teens actually need some stress in order to build resilience. I think we've lived in an age where we really try our best as parents to protect kids from all kinds of stress. And, there's some thinking that may have some consequences that we hadn't really predicted there, and that they're not able to sort of learn the way to cope when things don't go their way. I think this pandemic is a different use of the word resilience and stress and trauma. And I think, but I think some of the same principles apply. So in the research put out by the American Psychological Association, they talk about the things you can do whenever you're going through something really stressful, when you're kind of in the middle of it, to help you get through.
Right.
Things you can do after that might help you sort of recognize what you went through as an opportunity for resilience. And so a lot of the things you can do during are the kinds of things that have been posted all over social media and all over different websites and resources. So making sure that you connect with the people in your world that you trust, that will be validating and empathic to you, and that will take the time to listen to your concerns and how you feel about this stressful situation you're going through. And also to really feel your feelings. I think we oftentimes try to kind of push negative feelings down. We don't really like to go there. We like to get rid of it as much as possible, as quickly as possible. And this is a situation that's going to produce anxiety. Like anxiety is a normal, natural emotion. It totally makes sense. Yes, there is such thing as an anxiety disorder. That is something, but having anxiety related to this makes a lot of sense. And naming it as such and noticing it, and then letting it pass on versus grabbing onto that and really trying to kind of dig on it and hold with it. We always say emotions love them. So if they'll stay and get worse and spiral. But instead, if you just acknowledge it, that actually helps it move through.
Wow. Yeah. So like naming it, allowing it to exist, feeling all the feelings, not trying to just say we've just got to be positive right now, right? And we'll somehow get through it. But being in articulating our anxiety or our stress is you're saying that's kind of critical to
Yeah.
getting to a healthy place.
Yeah. And certainly there's times for optimism and there's times for hope.
Right.
And when positive thoughts happen, grab onto those too. I mean, that's okay. It's
Right.
just being careful not to skip over the more quote unquote negative feelings, which I would argue all feelings have their place, but the more negative feelings that we tend to label that way, giving some space to those, because we know they can't be ignored. And we know that when you try to push them down and ignore them, it actually makes them last longer. So
Right.
much better to just
Just to feel them and let them exist, right? Because if we push them down, they'll come out in weird ways, I imagine, like come out sideways, and then we're not going to be particularly healthy for our families or those folks who are depending on us. Yeah.
Well, and emotions give us useful information, right? Like that's the point
Mm,
of emotions. I mean, they motivate us oftentimes, like anxiety usually motivates you to kind of run away or to pay attention more to something, to be more
yeah.
alert,
Yeah.
right? In this case, we all do
We
benefit from
need.
a little bit of anxiety because there's indeed, something there that could go really bad. So you need a little bit to
Yeah.
pay attention and stay alert. At the same time, if the anxiety gets too intense, it's not effective. So emotions tell us something. They also help us connect with other people. And so I don't think ignoring them at this point is going to be helpful. And so one thing to build resilience is just noticing it. Um,
Okay.
and like, yeah.
What other do you have any other tips for us? Like to like maybe one way, could you help us maybe put together a simple, this is totally off the cuff. You may not have the tools to do this, but I imagine you do. Like how do we create like a simple way for us to gauge how we're feeling? Like how do we, like for me with an anxiety disorder, like I had to learn not to trust that so much, but I had to develop like, okay, not like a body scan, but like an emotional scan, or like, are there ways that we can actually name or figure out what we're feeling and articulate that better instead of just like letting it kind of like vomit out of us whenever we like interact with folks or when we're like spiraling? Is there like, are there some tools we can use to like help us name and identify what we're feeling?
Yes. Yeah, so this is something I would love to see us all doing all the time, not just during a time of pandemic.
Yeah, crisis. Yeah, yeah, right. Yeah.
So there's one website that I've actually used for years. It's called mood247.com. I'll send
All
you
right.
for it so we
Cool.
can add it to resources. It's a website that I think it came out of Johns Hopkins. You'll see when I send it to you, but you can sign up and they send you a text once a day at the time that you set. And it just simply asks you on a scale of 1 to 10 to rate your mood. And you can type back a number. And then if you want, you can type in a little note. Now, I've been using that system for, gosh, probably 8 years by now.
Yeah.
But since then, we've also had some really good apps that have come out.
Yeah.
So I would say a good example of one that I've been using lately that I like is called Dailyo.
Okay.
And literally just sends you a little prompt every day to rate your mood. And so I think figuring out these ways to kind of scale your mood for yourself is important. And in CBT or cognitive behavior therapy, we often call it making like an emotions thermometer. So just giving yourself kind of a scale and figuring out, 0 is usually calm, cool, collected. 10 is usually the most freaked out you've ever been. And so then figuring out along the way, what are some of the signs in your body that you might be at a certain number? So like the physiology, things like your heart feeling a certain way, you sweating or not sweating, stomach feeling a certain way. We say looking at your thoughts. So, how kind of intensely negative or distressed are your thoughts at a certain number versus how kind of chill or calm are your thoughts. Looking at the way you feel. So how do you kind of label that feeling, right? And so really just kind of over time developing your own scale so you know yourself, and then using that scale to track through whatever texting, website, app, or good old journal paper, if that's the way you want to, so that you can look over time for patterns. In a non-pandemic time, I would work with teenagers to look at different days of the week and notice as they rate their mood. The Sunday scaries is a good example, right? A lot of times when people start their mood, they notice on Sunday night, their rating tends to be a bit more on the distress side. And so then helping people figure out how to organize their lives to address that. Maybe it's not a good idea for somebody who gets the Sunday scaries to wait and do all their homework on Sunday night. Maybe that's better done on Saturday, and Sunday is watching TV, a show that you like, So using the data to make your life work for you in the ways you want it to. But I think
it's not hard data to get. It just requires like us to actually do it, right?
Yeah.
Like, it's amazing. Like, I don't know. I've always been like, yeah, whatever, blah, 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 journaling, or hey, yeah, that's cool. But then I found myself actually doing some of this stuff and I was like, oh my gosh, it's like the best life hack ever. Like, just being in tune with like my feelings enough to where I can adjust what I do based off of how I feel, and being able to organize our days. I think it'll be particularly helpful for us who are going to see a lot of the days kind of blur together, and like being able to say, okay, at this moment, in this present moment, I feel like this and why. And then there are obviously all the things we can do to move ourselves back down the scale. If we're riding at a 7 or 8 for a couple days straight, there are things that we know we can do, right? Breathing exercises, prayer, meditation, exercise, like all the things that are just like, yeah, well, you should do that, right? We can actually do them and move ourselves back down the scale. I just think it's a really powerful, simple tool that everyone can do at any time. That inventory just is not inherent in our world. We don't set aside time to take inventory, I would think, of our emotional state.
Yeah. Well, and I think oftentimes we tend to have the belief that emotions are somehow bad or unhelpful. And so, especially those negative ones, quote unquote, like anxiety or sadness, and they all serve their function. And so, I think just having a scale like that can be helpful. And I'm more of a child adolescent psychologist. So I also love that idea because it gives parents and teens a way to talk about emotion intensity with some shorthand. As long as everybody kind of knows the emotion scale, it's an easy way to talk about how you're doing without maybe getting into the nuance. And for some people, it's really hard to label their emotions. And so starting to practice out by just at least labeling the intensity can be a really useful first step. And then, like you said, you can then choose to try to do something to change it if you notice a pattern or you notice something that's not working for you.
That's cool.
That's
really good stuff.
Reminded to do too. I mean, I will tell you, I was walking my dog yesterday and to one of my favorite podcasts, and it was going deep into like a COVID interview with somebody in Italy, and I found myself getting like really anxious and and really had a couple
Was it
moments.
the daily interview?
Yes, I love the daily. Yep.
Oh,
Yeah.
I listened to it this morning.
Ugh, yeah.
I'm not posting that. Not that there's anything wrong with it. It's a beautiful interview. It's just
It was.
it was anxiety producing. Like I
Yeah.
felt like I had to take a nap after I listened to it.
Yeah.
It
Well,
was
so I was
just
walking around, the good old park by my house and like, had tears. And I had to take that moment to kind of be like, okay, what is going on? And so when I got back home, I sat down and I pulled out like one of my favorite therapy worksheets that just really helps you like go through the pieces of emotion. And I filled it out for myself like on a legal pad because I needed a minute to really understand that. And I think that these are the ways that practicing these things over time help you and they can become more automatic. But there's also a lot of resources out there for when you are overwhelmed and need a reminder of some of the steps or ways to slow
right.
things down.
Anything else you can think of that would be helpful for us, like in these trying times?
Yeah. I mean, I think you're hearing this from everybody. I will echo it. Find ways to connect, right? So I this whole idea of sort of social distancing, I think it's really physical distancing, right? That we're trying to do. And so um figuring out a way to connect to people, whether it's through a Zoom call or I will tell you, my group of friends last night after we had a church call, but after that call, my friends and I got on a Google Hangout and five of us sat around and just like talked to each other. And it was kind of
Yep.
like a happy hour, but we were sitting at our houses, right?
Right.
And my family tonight is going to do dinner over a Google Hangout. So I think finding some ways to connect. Honestly, we could have been using this whole time to connect to each other more often, and so maybe we'll take that from this later. But being creative with the ways you connect to people and trying your best to figure out some of these ways to have face-to-face connections. I do think
Mhm.
that's even better than the telephone, and making you really feel like you're there with somebody. So if you know how to do that, do it. And if you can help somebody in your family who's maybe
Mhm.
doesn't know how to do these things,
Right.
trying to teach them how, I think can really help us as we go through this period of time.
Yep. And I'll just add this disclaimer, if you are having trouble connecting, there are people who can help you get connected. So don't be afraid to reach out if you need help. And also, if you're experiencing some sort of mental crisis, you need to like call your doctor or your health professional and get it taken care of. This isn't a good time for us to think that like we also shouldn't be taking care of those things. So I really appreciate the time, Jenny. I always love talking to you about this stuff because you're brilliant and you definitely have done a ton of research. And I imagine maybe we could do this again since it's looking like we're going to be in this
Yeah.
state for a while. So thank you so much for the time.
Yeah. And let me know if there's any particular topic or questions that are coming up from people in our community that I might be able to speak to. I'd be happy to do a little homework for everybody if it would be helpful.
All right, Jenny. Thank you
Uh,
so much. Take care. See you
all right.
later.
Well,
Bye.